Good morning, respected judges and everyone present in the room. My name is Dr. Jessica Basumatari, and I'll be presenting a talk on USG-based study of ocular trauma in a tertiary care center in Northeast India. Introduction. The WHO has estimated that blindness resulting from ocular trauma affects approximately 1.6 million people worldwide annually. The incidence of blindness associated with facial injuries is very high, it's around 10.8%, and the examination of globe is difficult after trauma. The presence of periorbital soft tissue swelling and other injuries pose difficulties during the examination, along with factors like poor patient cooperation. In such conditions, B-scan ultrasonography is an imaging technique which can be utilized. It is non-invasive, user-friendly, reliable, and reproducible. My study is a hospital-based retrospective study. EMR of all patients who presented to the emergency clinic with ocular trauma and underwent ultrasonographic examination of the eye from January 2020 to December 2020 were reviewed. Details such as the date, time of injury, time of presentation, eye involvement, mode of injury, type of injury, and B-scan findings were noted down, along with demographic details like age and sex of the patient. In fresh globe injuries, the globe was first repaired, following which the B-scan was done. So the sample size was 275 eyes of 269 patients. Inclusion criteria were ocular trauma, in which the posterior segment evaluation with IDO was not possible, because of which B-scan had to be done. And second, ocular trauma with clear media in suspected IOFB cases. Exclusion criteria was infective keratitis secondary to trauma. The results were, most of the patients, the age group, mean age group was between, the range of age was between 9 months and 82 years, and the mean age was 25 years. Children were found to be more susceptible to ocular trauma, around 36.8% were involved. Sex distribution, males is to female ratio was 3.9:1, and in my study, open globe injury was found to be more common than closed globe injury. Time of presentation, most of the patients presented between 3 to 7 days. Within 1 hour, only 2 patients out of the total 279 patients had presented. The most common source of injury was a non-metallic object, which accounted for injury in 48.32%. Metallic objects accounted for 23.79%. Other causes were firecracker and physical assault, RTA, blast injury, and chemical spillage. Visual acuity at the time of presentation was recorded in 82.54% of eyes. A visual acuity of counting finger at 1 meter to light perception was recorded in most cases, that is 70.04%. In ultrasonography finding, most common finding was normal ultrasonographic study, followed by retinal detachment, followed by lens injury, vitreous hemorrhage, and others were ONH, avulsion, IOFB, endophthalmitis, panophthalmitis, phthisis bulbi, and hematoma in orbit. So these are some of the pictures that I collected. The first picture is a picture of retinal detachment. Second, a vitreous hemorrhage with inferior layering. Third is a picture of a posteriorly dislocated lens. This is a picture of intraocular foreign body with a very high spike and posterior shadowing. Then choroidal detachment with dome-shaped lesion. Endophthalmitis, panophthalmitis with T sign, optic nerve avulsion, and phthisis bulbi. So discussion, when compared with other studies, we found similar findings in other studies as well. In our study, most of the patients had normal findings on B-scan, which was seen in other study like this one, which was conducted in a hospital in India. The male is to female ratio in our study was higher than other studies. It was 3.9:1, whereas other studies like I have listed below, the sex ratio ranged between 2.7 to 2.9:1. Children were found to be more susceptible to ocular trauma, followed by middle-aged adults, which was comparable to other studies. The most common source of injury was a non-metallic object, which account for injury in most of the patients, 48.32%. Which was also found to be similar to other studies. And in our study, open globe injuries was more common, whereas other studies had closed globe injuries. So the conclusion, to summarize, ultrasonography database can be utilized to determine the burden of ocular trauma in society. And the WHO estimates that blindness from ocular trauma affects approximately 1.6 million people annually, and B-scan is an important imaging technique for examination of globe after trauma, which can be quite challenging. Thank you. These are my references.
Thank you, Dr. Jessica.
Yes.
What are the limitations of your study?
Sorry, sir?
What are the limitations of your study?
So the limitation is that it is a retrospective study. and it is a descriptive study. So I could not make any correlation between, say, the time of presentation or the visual acuity and the final visual outcome. That was not done. However, I have managed to gather other information like male is to female ratio, then the findings on B scan and such. Thank you so much.
Thank you.